Hello everyone, my name is Dr. Susan Kafley, and today I'll be discussing about the common medical insurance plans that are tested on USMLE. So let's begin. This is the type of question that you will be encountering on USMLE exam. A 35-year-old woman recently moved to a new city and is selecting a health insurance plan. She prefers having the flexibility to see any specialist without a referral, but is willing to pay higher monthly premiums. Which type of health insurance plans best fits for her preferences? These are the four options that we'll be discussing about. So the plans that you should know for USMLE exams are basically our HMO plan, the EPO, POS, PPO, Medicare, and Medicaid. Let's start with the first one. So before memorizing any plan, like what it covers and what it does not, I have developed this framework where you can visualize the plans, and then you can visualize this diagram, and then you can recall all the plans that I just listed. So inside this circle represents a network, and inside the network you have this primary care provider, and the whole white part outside the circle is the part that's outside the network. So there is a plan where an individual must have a PCP and can see a specialist within the network, but for doing that, he or she needs a referral from her PCP. This is a HMO plan. There is a second plan where you can not only see for a specialist within the network, but also the one outside the network. But since the line is solid, so the referral from the PCP is required. This plan is the point of service plan, where you need to have a PCP, and PCP makes the referral to the specialist, whether it is inside or outside the network. The third plan is where PCP is not mandatory. Now this dashed line represents that the PCP is no longer mandatory. You can either have a PCP or you may not have a PCP, and you can see any specialist within the network without the referral from the PCP. So this plan is the PPO plan, or exclusive provider organization plan. And lastly, there's a plan just similar to this, which provides you the flexibility of seeing the providers from outside the network, and you need not have a PCP. You may have one if you need, but it is not mandatory. So this is a preferred provider organization plan. HMO and POS, PCP is mandatory. In HMO, you can see the specialist only within the network. In POS, you can see the specialist outside the network, but you need a referral. And in EPO and PPO plans, the PCP is optional. You may or may not have a PCP, and in EPO you are just allowed to see a specialist within the network, whereas in PPO plan you are allowed to see the specialist outside the network. Now, as you can guess, HMO plan is the most affordable plan, whereas PPO, which gives you a lot of flexibility, it is the most expensive plan. It has high deductibles and copays. I'll be talking about the deductibles and copays in my next video, but for now, remember this. Apart from this, we have some federally administered plans like Medicaid and Medicare. So Medicaid is basically for low income people and pregnant women, so you can remember D for destitute. And Medicare is for people who are more than 65 years of age, younger people with disabilities, and people with end-stage renal disease or amyotrophic lateral sclerosis. Medicare has four parts, so I've made this mnemonic to remember or what the components of these parts. So hospitals provide affordable drugs. So part A is starts from H. All right. So part A, it is for the hospital services, in-hospital services, home health, hospice, and healthcare nursing. The second part, Medicare Part B, starts with a P, so it includes physician services, the outpatient services, the physician services, preventive care services, pathology tests like diagnostic tests, and procedures, which include surgery and observation. In Part C, it starts with A, so Part C is also called Medicare Advantage. It is Medicare Part A and B insured via private plans, and Part D, D stands for drugs. So Part D includes prescription coverage via private insurance. So as you can see, Part C and Part D have private private insurers involvement in their plans. Now there's something called this Affordable Care Act, which states that whatever be the plans, The preventive services are always free in all the plans. Like if you have a HMO plan and your deductible is yet to be met, and you go to an office, you don't have money, and you need to get a mammogram. So in that case, that should not cost you even a single penny, because uh, this is a preventive service. And the second thing is, insurance plans are prohibited from denying coverage or raising monthly premiums based on a patient's pre-existing conditions. Yes, so for example, a person with a diabetes and chronic kidney disease goes to get an insurance, and the insurer knows that the person has diabetes and CKD, and he or she might be needing more medical care than the other usual patients. So there is a natural tendency to feel that the cost of getting an insurance for this person will be higher for them, but they cannot deny this coverage or raise the premiums based on his or her condition. So that is the second thing. And the third mandatory thing is the private and marketplace plans should cover all the essential health benefits. These are the 10 essential health benefits I've just listed here, if anyone is interested to learn about them. But there are some services that every plan should cover, but Medicare and Medicaid may not cover all these 10 services. So now let's solve the questions. A 50-year-old man has an HMO plan. He wants to see a cardiologist for a new heart murmur. Which of the following is true regarding his access to the specialist? He can see the cardiologist without a referral. He must get a referral from his primary care physician. Option C is he can see any cardiologist in or out of network without restrictions. And option D is he can only see an out of network cardiologist without paying more. Now, if we remember the diagram that I discussed during the presentation, so the correct answer would be option B. He must get a referral from his PCP. Remember, HMO and POS plans required referral from PCP. The second question, a 35-year-old woman recently moved to a new city and is selecting a health insurance plan. She prefers having the flexibility to see any specialist without a referral, but is willing to pay higher monthly premiums. Which type of health insurance plan best fits her preferences? So as you can see, she wants to see any physician without a referral. So that just curtails us down to, so HMO and POS always require referral, and she wants to see she wants to pay higher monthly premiums, and flexibility to see any specialist has been mentioned. So any means both within the network and outside the network, and so the correct answer would be preferred provider organization. So that's it for this presentation. I hope you liked it, and I hope that it helps you solve your questions on the exams. Thank you. See you next time.